saw a Broadway play last night here in New York City.
How was that? You were telling
it
me
was
that.
great. It was a woman in the movie is a professional, and she finds out she's pregnant. It's a reluctant pregnancy. And it's the life-changing moment of going from being an individual to being a family.
Okay.
And that really was near and dear to my heart. I have 3 children.
Yeah.
The age 4, 6, and 8. And I'm a working mom. I have a full-time, very busy practice, mostly focused on breast and body contouring, breast reconstruction, as well as cosmetic surgery. And most of my patients are moms. Most of my patients are either moms who have been giving and working for everybody else, and their entire existence has become about taking care of others.
Sure,
right?
sure.
And they work out. They take care of themselves. They eat a healthy diet, but multiple pregnancies or even one pregnancy can make a big change in your body. You start to look in the mirror and you see somebody else. You start to notice that you look a lot more like your own mom.
When does that start?
It starts
immediately.
It
for
takes
my wife, for example, so she's going to have a kid in 2 weeks or 2 months.
Yeah, so after a pregnancy, it takes about 9 months for the changes of pregnancy to resolve. And, my first pregnancy, I thought I was eating healthy, but I was also kind of giving myself a pass, like, oh, I want this, I want that, partly because I was just so hungry, right? So I gained some weight, like a lot more weight in that first pregnancy.
Yeah.
And then it takes months for not only your body's natural anatomic structures to go back to the normal position, right? But also for you to lose the weight that your body gained in an effort to be ready for any type of upcoming famine. The purpose of all of that fat, why are you so hungry during pregnancy, right? Why do you crave ice cream?
Yeah.
Why are you constantly hungry? Well, most of human history, right? You had to retain fat stores sufficient enough to nurse that baby until the baby's old enough to eat solid food, right? Or at least like pre-chewed food, right?
Yeah.
So that's about 3 or 4 months. So most healthy women carry at even a size 6 or a size 8 woman, she's carrying enough fat to nurse a baby on top of her own dietary needs. Nurse a baby, if you just give her water, right, and her normal calorie intake with no increased calories, can nurse a baby to 4 months of age.
Wow.
Right? That's what's on her thighs.
Yeah.
That's what's on your thighs.
Okay.
That's what curves are for.
So that makes sense.
Is to raise a baby.
Yeah. So then for the new mother who's her body's starting to change, this is 100% biological for a really good reason. It's to support the child.
Right.
It's not that, oh my God, I'm fat now or this or that.
Yeah, but we
It's
don't
just,
live on the savannah, right? We're not like migrating across the savannah and we have to get fat reserves. So when those cravings, and what I found by the time I got to my 3rd pregnancy, I discovered that I could swim laps, I could eat salads, and that I would be just as satisfied with the most delicious salad in the whole world. And I would feel great if I swam laps and walked. I was in Paris during my 3rd pregnancy, and I walked the city hours every day. I came home fitter than I left, and I was 6 months pregnant.
Okay.
But that each pregnancy is different, right? So your body goes through some changes. Your abdominal wall muscles relax. The rectus muscles come apart.
What are the rectus muscles?
The rectus muscles are the 6-pack muscles.
Okay.
The rectus muscles are the 6-pack muscles on the anterior abdomen.
I don't have those then.
So those things that you're trying to build up when you're doing sit-ups, the things you see in those beautiful Instagram pictures of like super glamorous ladies.
So they're split to make room for the...
Right. So, when you're young and you haven't had a baby yet, you have this flat, tight abdomen. It's just super tight, right? And then you have a baby and those 6-pack muscles on the anterior abdomen start to pull apart. Those are called the rectus muscles. The rectus muscles start to pull apart. And there's a band between them, a broad, flat band. And that's called a diastasis. That diastasis develops. It's a gap between the rectus muscles that makes room for the baby. By the time you're at the end of pregnancy, the baby is sitting in between the rectus muscles, and the rectus muscles are way out on the side. That's why a woman who's 8 or 9 months pregnant can't do a sit-up without help. She's like, hey, can you help me get up?
Yeah.
Because she has no leverage.
Where my wife's at right now, yeah.
Yeah, and then after the baby comes, this is when it gets really crazy, is that you're laying on your back, you've got this big, loose, floppy tummy, and you try to do a sit-up, and this shark fin pops up, okay? This like shark fin gap between your rectus muscles, because now your rectus are on the front of the abdomen again. And this gap pops up on your abdomen when you do a sit-up because you have all the looseness of the structures of your abdominal wall. That looseness takes at least 9 months to develop and 9 months to resolve. Right?
Okay.
So for 9 months after the pregnancy, you'll hear the mom come in and she'll say, how many sit-ups do I have to do to get rid of this? But the gap between the muscles will never get smaller with sit-ups. You can make your rectus muscles thicker and you can strengthen your core, which is a great idea. But when there's a gap between the muscles, a thinning of that fascia will not come back together with exercise. So that's called a rectus diastasis. And the later your pregnancy, the more likely you are to develop those injuries to your structural tissue on your abdominal wall. So we can at the time of a tummy tuck, we can repair those muscles using a series of sutures down the abdominal wall. And that's like an internal corset, just a little row of tightening sutures that brings those six-pack muscles back together so that you have a nice, tight, firm abdominal wall, restoring the natural anatomic position of the six-pack or rectus muscles.
So this is really kind of the first step of the mommy makeover?
Right.
Okay.
One of the most common problems after pregnancy is that separation of those muscles. So when we repair the muscles, bring them back to the anterior abdominal wall, then we are able to second address the skin laxity. Mm-hmm. And sometimes there's a little extra fat.
Sure.
Especially as we go from 30 to 40, you start to develop thicker fat pockets in certain areas. A little bit on the love handle, a little bit around the belly button, maybe a little bit in the upper inner thigh. Those are easy to improve with just a small amount of liposculpting. So a little bit of body sculpting, repair the muscle. If there's a little bit of extra skin, we can remove that. If there are stretch marks, we can remove those just with a little short tummy tuck incision. I have patients who I've done a tummy tuck for through an incision as short as a C-section scar. Because their main problem, it's a yoga teacher, super strong body, but the muscles have gapped, so we can repair those. Right. Very small incision, minimally invasive approach, just to restore the natural anatomic contours of the abdomen. The second complaint that I often talk to patients about, they come to me and they say, I love my body, I'm a yoga instructor, I work out every day, but I nursed 3 kids and my breasts, I look in the mirror and where did my breasts go? I had breasts and now they're gone. They have a deflated appearance, maybe their nipples are pointing down just a little bit, or maybe one is slightly bigger than the other, but they don't have any cleavage. That's almost universal. When you have a pregnancy, and your wife is pregnant right now, right? So during pregnancy, the gland inside the breast matures from an immature state, which is before pregnancy, the gland inside the breast is physiologically immature, and it's only at the completion of pregnancy does the gland become mature breast gland. And that gland has a different texture and a different density. So the pre-pregnancy gland is a little bit denser, a little bit thicker, a little firmer, and after pregnancy, the gland softens and matures. With nursing, the breasts get larger and smaller hundreds of times during the course of breastfeeding.
Sure.
And that will also cause a little deflation of the skin. So you develop deflation of the skin, and you develop a natural softening of the gland as the gland matures into adult woman's breast parenchyma. And so you get this deflation in the upper breast, and that's one of the most common complaints. Even the most fit and athletic mom will say, my breasts are empty at the top, I have no cleavage. Or I look good in a bra and I take off my bra and I don't like what I see. When I meet with the patient, we'll talk about her concerns. She'll show me what she sees. I listen to the patient. What do you see when you look in the mirror? Show me. And they'll show me, and we'll talk about the deflation in the upper breast. We'll talk about the size that she's looking for, talk about her daily activities. I would never want to do a large augmentation on someone who's planning on being a runner. I wouldn't recommend that, right? It's going to be difficult to do a lot of high-impact activities with very large breasts.
Yeah, makes sense.
I often will ask a patient, when you're in your favorite bra, do you like how you look? When you're in your best bra, is your volume enough? Because for some women who come in and say, I'd like breast implants, what they actually are telling me is, my breasts are deflated, I want to have more fullness. But if they like their fullness in their best bra, then what I could do is just a breast lift and tuck that tissue up. But if upper pole fullness is their main concern, a small implant might be needed in order to develop the upper breast and to get that cleavage that they're looking for. So each patient's own concerns and her individual view of her body is going to dictate the direction that the conversation goes.